Practice proper posture when sitting, standing, and sleeping. If you have a desk job or one that requires long bouts of driving, make sure you have good lumbar support in your chair or make an effort to stand up and move around every 30 to 45 minutes to relieve pressure on the lumbar spine and or your piriformis muscle. It is best to either sleep on your back with your legs elevated or on your side with your knees slightly bent with a pillow between them to provide increased nutrition to the discs of your spine. Also, avoid placing your wallet in your back pocket for you gentlemen. This causes the pelvis to be uneven when sitting and can put increased pressure on the piriformis muscle.
Exercise regularly. Your physical therapist is a great source of information regarding the proper stretching and strengthening exercises you can perform to help improve your flexibility and strengthen your core and hip musculature. And here are 3 of our favorite exercises to help address the impairments often associated with sciatica.
The first is sciatic nerve glides. The patient lies in supine with their knees bent and then gently pulls one thigh toward their chest until they're holding their hip in a 90-degree angle. They then extend their knee as far as they comfortably can and flex and extend their ankle if able. This motion helps to reduce neural tension in the leg and assists the sciatic nerve in gliding smoothly inside of the sheath where it resides. A good starting point for repetitions is 2 sets of 15, but may vary based on patient tolerance.
Second exercise is piriformis stretching. The patient lies in supine. Depending on their flexibility, level of pain, and whether or not they have a spinal pathology, they may begin with both legs bent or straight. Bending the knees is an easier variation and reduces stress to the lumbar spine. The patient then reaches for the outside of one knee and gently pulls it up and across their body, aiming toward their opposite shoulder until they feel a comfortable stretch in their buttock region. If performing the bent knee variation, the patient may rest the ankle of the leg they are stretching on the opposite knee in order to assist in supporting the weight of the leg. They would then attempt to hold for 30 seconds and perform 3 repetitions on each side.
The third is core stabilization training. The transverse abdominis muscle is the deepest abdominal muscle. It normally contracts prior to upper and lower extremity movement in an effort to stabilize the lower back and pelvis. However, in patients with low back pain, there's a delay in the contraction of the transverse abdominis. It is imperative to guide the patient through the optimal transverse abdominis contraction training. The patient will lie in supine in a hook-lying position with a stabilizer pressure biofeedback unit placed under their lower back. Pump up the stabilizer unit until the patient feels the bag engage in the lower back. This desired starting pressure will fluctuate per patient based on the lumbar spinal curvature. At this point, guide the patient to the location of the transverse abdominis through palpation. As the patient inhales through the nose, teach them how to exhale through their mouth as they contract the lower abdominals. Then document the patient's strength and endurance of the contraction. This provides tactile and visual feedback to the patient to allow for optimal training. The patient can begin with daily exercise sessions of transverse abdominis training at 10 seconds for 10 to 15 repetitions. A progression can be made into abdominal bracing with unilateral or bilateral isometric hip flexion. Transverse abdominis activation in quadruped is also an alternative position for training.
We hope you enjoyed our sciatica video.
If you have any further questions, please feel free to contact your local Therapydia clinic.
Stay well!